Greetings. Welcome to another Miami Corona Project conversation. I am honored, truly delighted to bring to you Commissioner Daniella Levine Cava, a friend for more than 30 years. I first met her in 1992 and have worked side by side with her in this community. She is a leader who my district was honored to elect as a commissioner and then re-elect as commissioner. She's also a mother, a friend, someone who cares passionately about our community, and currently seeking to lead us as mayor of Miami-Dade County in an election happening in August. And I just thought it was very important to capture the voice of not just a civic leader and a neighbor down the street, but also for someone who aspires to lead us through this pandemic. Daniela, welcome to Miami Corona Project Conversations. It's so wonderful to have you here.
I knew that you were doing something important during this pandemic, not just creating beautiful art. So thank you so much for having me on.
Daniela, how has the pandemic impacted you personally? We'll talk about how it's impacted you as a community leader and our community, but you personally, how has it impacted you?
Well, it's really devastating personally to me to see the hardship that people are experiencing, hardships, going through the food distribution lines, people coming at midnight to get maybe enough groceries to last a week, sleeping out. It's people who never ever thought they'd be in that situation. It's a great unifier, this crisis, in many, many ways. That has been really disturbing, but also has a grain of hope in the sense of we hope that people will take that compassion and extend it out and think about how did we get to be in this situation where people are so close to devastation, one or two paychecks away, or the kinds of jobs that make them so vulnerable, and not having the luxury to be safer at home. So many circumstances that really showcase the disparities in our society. The fact that more Black Americans are succumbing to this disease than others, more Hispanic Americans succumbing than others. What does that say about our healthcare system? What does it say about systemic barriers to getting the kinds of help that people really need? So hopefully it's a wake-up call for the nation, even as we recover economically, that we can recover better than who we were before.
You've been that voice, right? Speaking about community. I know that because a lot of your environmental work and through the years when you founded Catalyst back in, was it 96? Catalyst Miami,
That's
right?
right.
As an organization, a social service group. You've always had that perspective about addressing inequities. And in a pandemic, my God, those inequities are exacerbated, right? I have Instacart. Like I don't go to Publix. I have the luxury of having my groceries delivered to me. There are people who have no choice, right, but to work in crowded conditions and to, be exposed. And I'm just wondering if there are places, whether it's in our transportation system. You just talked about people's the economic inequalities that exist. Are there places and spaces across Miami-Dade County, but also sort of broadly in our society where you're seeing some structural reform necessary to address this in healthcare? And I know you tried to get family leave. Like what kind of governance policies need to be
Right.
effectuated so that we can better prepare for the next pandemic?
Yeah. Well, of course, sick leave, paid sick leave, was something that I brought to remedy a gap in our living wage policies at the county. The state precludes us by law from mandating these things across the board, but for county workforce, including county contract workers, we could require paid sick. And it was devastating to me personally and to the working men and women who need this now more than ever, that it was rejected by the commission. These are people that are living day-to-day paycheck. If they don't work, of course, there's no cushion. If they are sick, they either go to work sick or they stay home and lose a day's pay and risk losing their jobs. Same for family members, same for going to the doctor, whatever it is. So this really is inhumane, in my opinion. And the world knows how inhumane it is now that they see the risk to public health of people going to work sick from this highly infectious disease. So that did not happen here locally. I hope it has happened in other parts of the country. We know that 83+% of Americans think that this is important. So, God willing, these policies will change. And actually at the federal level, it did change. A pandemic sick leave was authorized, but that does not affect everyone, unfortunately. So what are some of the better things that have happened? I think employers that can let people work from home are doing so. I think we're seeing a real shift. I think that is beneficial in many ways. I find it, it's sad not to be with my coworkers physically, but it's also efficient, saves travel time, saves traffic congestion. But we know that so many can't do that. They have to be physically present. I hope that it will lead to increased recognition of the value of essential workers. I saw that in some places in the country, healthcare workers' salaries are going up because we recognize the incredible sacrifice that they're making on behalf of all of us. I don't know that that's happened here locally yet, but I do think that we really need to reassess our priorities and the value of the work.
I've known you to be an incredible environmentalist. In fact, as an environmental artist, I can tell you are the most important and valuable voice from an environmental perspective on our commission. You have been a water warrior. You have cared a lot about environmental degradation, trying to protect us and our health with environmental concerns. And of course, the issue of the environment and the pandemic are interrelated. Pandemics are only going to become, in my opinion, and I think science's perspective, more common, more fatal, more infectious in the years to come because climate crisis exacerbates the species, the animal to human transmission of viruses. Because as we deforest areas of wilderness, these animals come into contact with humans, and as the northern latitudes get warmer with climate change, the vectors of disease that would otherwise not be able to be in our communities automatically are here. So there's great reason to not forget about the environmental concerns, to continue advocating and engaging in forward-thinking policy, not just to address sea level rise and all of the consequences of that, but also public health here today, people who have heat strokes, people who are going to suffer from other diseases. And I'm just wondering if you've seen a disconnect between environmental issues now that everyone is just focused on the pandemic as if they're not related. Are we taking steps backward across our community? What do you think, and
Yeah.
what can we do about it?
Well, thank you for raising the point, and I am quite concerned that, in fact, we've created a false choice. I've seen it reported in today's paper that some cities in our county have retreated from their commitment to their sustainability committees, to some of their staff. One city has, in fact, eliminated a fund that they had established. Really because of the pressures of having to deal with the COVID situation. But it is a false choice because the climate change agenda is not going away. If anything, as you say, it's all the more apparent because of this rapid disease spread. I also heard something really positive over the weekend about this. I heard it said that COVID shows the world that we can come together with a common purpose to solve a big problem.
Absolutely.
And, the environmental crisis has, not been as collaborative. We have the Paris Treaty that, of course, the United States retreated from. We are part of, in Miami-Dade County, a network of cities and counties that have voted to endorse the treaty, to get around the fact that the national government has retreated. But it's true that here we are as a global society, aware of our interdependence in a way that we really have not acknowledged before. And while there are some pettinesses and some competitions, I think really we're all cheering each other on, right? China's success is our success. South Korea's success, Brazil's success, God help us. Of course, the president has just, brought down the wall, but, we're so much more to blame even than Brazil for our own inability to control the spread of this virus. So, it's creating a narrative globally that we're together, even while some of our leaders are pretending it's not the case.
Sure.
So let's use that as a platform to redouble our efforts on climate change and global warming. We know that this, the pandemic, all right, we will get a vaccine. We will learn ways of containment. There will be other diseases that will present themselves, and we will learn, just like South Korea learned from SARS, we will learn from this experience. And let's use the lessons learned to apply it to the existential crisis of our planet.
Our time, sure.
So I am very excited as the future mayor of Miami-Dade County to be the one that can lead us forward. I think Miami-Dade County is the canary in the coal mine. We know we have the most assets at risk from sea level rise of any place in the world. And it's just time for us to step up boldly and show the world that we will be at the world table, inspiring people to take action together.
I know that is your cause. You are the water warrior. You were there with us at the Hibiscus Gallery in Pinecrest Gardens, deputizing,
Yes.
having all the members of the Underwater Homeowners Association take their oath. And I do so value your leadership in environmental concerns. Absolutely, you are a candidate for mayor. You are looking to lead the largest county in our state, a home rule charter county, a mayor with an incredible amount of power to help shape the public policy and what will happen in this county in the next 50 years, and what will happen in the next year, 2 years after the pandemic, as we try to navigate through a pandemic that is still going to have economic and public health consequences. And I'm wondering, not wondering, I'd love to know what will a mayor, Levine Cava, do to help us navigate through this crisis the day after election?
First day, chief medical officer. I'll be appointing one because we must be science driven and data driven. And while we have some great experts in our community who have been tapped for this response, they are not at the head of the table. So we need to be sure that everything we do is not just advised, but guided directly by the science. So that is the first thing that I'll do. Also, I will bring together stakeholders, not just the business community. Obviously, the business community is, hugely affected by this, and the economy is everything for our future. So we need to have our businesses find the pathway through this to succeed. But we have other sectors that were not actively engaged, the nonprofit sector, the other governments. So while, for example, other cities through the League of Cities were in regular conversation about the business part of it, right? What should be closed, what should be opened, we haven't talked with them about their own functions and how we as a county can support cities to function. The cities have not benefited as the county has from direct federal aid, and they are being forced to make these choices, like shutting down their resilience efforts. That's not acceptable, because we need all of the cities to work. Just as we need to work globally, we need to work locally with our partner jurisdictions to get this right. So, I am the collaborative mayor. I've done everything in my life by bringing people together with seats at the table, and that is how I will lead us through this pandemic to the restoration of our economy, and to the innovation of our economy. And I think, as we said earlier, this is our opportunity to get it right. We don't have to be stuck in old models. What are the new business enterprises? What are the new career paths? What is the way that we partner with our school system to prepare our young people for those jobs of the future? This is like a reset button. We get this opportunity to look deeply and do things differently than what we've done before. And this is the time to do it. I got an email this morning from a constituent who was saying, in terms of land use and transportation, like, are we just going to go back to the same old, or do we want to really stop and think, how will people get around? Obviously, people are going to be working remotely. What does that mean for the repurposing of our built environment and of our natural environment? So these are great, great opportunities that we have to engage in some real innovative forward thinking.
The Miami Corona Project conversations are looking at a cross section of individuals. Three of the people that I interviewed prior to interviewing you included a professor of medicine in Malaysia who looked at the way that we deal with undocumented aliens here and the way they deal with their refugees there, and how that is impacting the public health of the community by pushing people into shadows. I spoke to Carlos Martinez, who is our public defender, looking at what's happening to individuals in those systems. I spoke with the president of the UTD about how teachers and students are being impacted. There's a lot of suffering right now in our community. We're hopeful, and I love that throughout this community, you've brought hope and you've looked at the positive things that we can do, how we can take these very negative circumstances and create them into opportunities. And I just want to end this conversation with a hopeful message, right? You've been in this community for a very long time. You've been leading us through the Human Services Coalition, through Catalyst Miami, as a public servant, a two-term commissioner. Person who's just listening, who wants to hear from you, like, what hopeful words do you have that in this time when they don't have paychecks, when people are getting disease, what can you do to assure them that we are going to be okay?
Right. I heard a term this weekend as well called stubborn optimism. And I think that's me. And you know what? It pays off, because as a world, things do get better. And we have these great setbacks for sure. And we have new challenges. Don't we all feel like we're in a science fiction movie? Like, this is not really what we ever anticipated. And people are suffering. But we know that at the other side of it, we can rebuild better, that we can take care of people better, that we know some of the things we did wrong, that we can do better. And so I am relentlessly and stubbornly optimistic that things will be better. But along the way, we have to remember that people are suffering, and we are reaching out best we can to get you through that criminal unemployment system, to get you through your inability to pay rent, to get you through your inability to provide food for your family. These basics cannot be overlooked. And in the new, better world, we'll not be stuck again with people having to beg to get the things that they need for basic human rights and dignity.
Commissioner, thank you for your vision.
Thank you.
Thank you for your leadership. Thank you for your compassion. And thank you for your friendship. So honored to talk.